back, everybody, to Pivot Point of View. I'm Dexter Millsap along with Becky Pearson, and today we are going to be talking about stifles. So, if you've ever had your horse have a stifle injury, everybody's question is, what do you do next? After you put them on stall rest, get them injected. There's all different sorts of severities, and honestly, stifle injuries for me are kind of the ones that make me the most nervous. And you just never know if they're going to have a good prognosis. In our young horses, we worried about OCDs and surgical options there, but uh, but there are things that you can do, and especially if your horse has chronic stifle issues. So today we're going to talk about some of that stuff. Becky, when you're evaluating a horse for a stifle injury, what are some of the things that you look for?
Well, first off, I start by looking at their gait quality. And so I want to see, are they dragging their toes? Are they able to bear weight on that leg evenly? What's their stride? Are they short on that side? And then I take a look at their range of motion. So passively, like I try to lift their leg up into high flexion, which is kind of like what your vet does when they flex the hock. And then you can also pull that leg back, which does check the range of motion on that stifle as well. So I look at those kinds of things and then I try to assess strength, which is really kind of hard in a horse. You like, in a person, we can have you put your arm out or your leg out and push on it and see if it'll give. But on a horse, that's rather difficult. And so sometimes you can assess strength by doing a lateral tail pull and seeing how well they can hold. Do they shift off of that? Or even like similar to like a neurological test, can you pull them off balance while they're walking? Because that will test hind hind end strength as well. So those are my main components with that. And then I formulate a plan from there. And unfortunately, over the years, I've had a lot of different stifle horses. Most of them in our program, from one thing or another. We had a young horse that had intermittent upward fixation of the patella, which is like a sticky stifle where the leg kind of gets caught, the stifle gets caught, the kneecap and the ligaments catch a little, and then they move out, move on, and honestly, stall rest on those horses actually makes that worse because it is more of a weakness. Um, and when they're not using those muscles, then it makes that just more evident, more prominent. And so that's a really easy one. I mean, it takes work, but it's a really good prognosis. You can strengthen that through a variety of different ways, which we've come up with a stifle program to help that. So that's probably the easiest one to rehab. And then you have all kinds of different variations as to degrees of injury of the stifle because the stifle is like our knee. Okay, so there's a kneecap or patella, there's ligaments that hold that in place, and then there's meniscus in there. And so, they can tear a meniscus, they can tear a collateral ligament on the joint, they can have, like you said, OCDs in the joint, they have bone chips in the joint. And so there's a lot of different things that can happen to that joint. Just like our knees can be injured very easily, so can their stifles. And so really depending on that severity of injury really depends from there where we go. So getting a good diagnosis from your vet is key really to then how you end up rehabbing it.
And what do we know about the muscles of the stifle? Because they're really not that different if you look and think about it like the human knee. You have your quad muscles, you have your hamstring muscles, and both of those are working to stabilize the stifle joint. So you mentioned the sticky stifle. So we know that the vastus medialis on the horse is uh, responsible for that locking mechanism. So what are some ways you said that if there's a muscle weakness that can maybe cause that, what are some ways that you can strengthen the quad muscle or specifically the VMO in a horse for that reason?
One of my favorite things to do is lateral tail pulls. And so, I mean, it's just literally what it sounds like. You grab a hold of their tail and you pull to the side. And you watch the muscles of their hip contract, which the muscles that you see on the outside of their hip is their quad. The quad muscles, if you, I mean, it's not, I'm not targeting one in particular, but when we can strengthen that, that can really, really help the horse gain a lot of strength easily. The old cowboys, they used to say, "Well, go to the hills with a stifle horse to strengthen them." And that is very, very good. Some horses are like that'd be like telling me to go squat 200 pounds in the gym. Like I can't handle that right away. And so you really honestly will need to build up to that. And when you do start hills, you want to start that slow and easy. You don't want to let the horse run up the hill. You want to make them walk up the hill so they'll get the best contraction of that. But hills, again, are a more advanced maneuver, and you really do need to build up to that. And so I start off with the lateral tail pulls, like 10 of them for 10 seconds, if they can handle it. Sometimes on the very beginning part of it, they can only handle 3 to 5 second holds on that. And you can do that, literally, you can do that like 1, 2 times a day. But you want to watch for body soreness. Same thing with us when we start a workout, we get sore. Like, so I kind of fell off the exercise wagon this week or for the past few weeks. I got back at it yesterday. I go to do the ab machine today. Oh, my abs were telling me maybe don't be so aggressive today. So same thing will go with these horses. Like they might get a little bit sore when you start to initiate these strengthening exercises. So watch their reaction. Are they grumpy? Are they tender to palpation? Um, Palpate that stifle, learn how to feel those ligaments right in the lower part of that stifle, because that's where you're going to monitor for swelling. You should be able to feel the two dips on the side of the that ligament, that center ligament. And so there's three ligaments that kind of hold that patella from the front. Um, and you should be able to put your fingertips in between those. And if you can't, then there's a lot of swelling there. And so get really familiar with what your horse's stifle feels like. So then that way you will notice a change in that stifle. So yeah, that's one of the easiest ways to start is just lateral tail pulls. And we have a whole program that is designed that we have on our app where people can purchase that, and it takes you through the passive range of motion. So if your vet has given you the okay to do stretches, so you want to get the range of motion first, and then you want to get them actively using that range of motion. Okay, so first we stretch them, and then we have them start moving throughout that range of motion. So, lifting that leg on their own. Sometimes they can do that over logs, cavalettis, whatever. And then you can move then into the strengthening part of it after they are doing good active range of motion. So that's where you get into a lot of that. The hills, the backing, those kinds of things are all good for stifle horses.
There's definitely a progression and different phases to it, which that is why I love our cycle program on the app. Is it has phase one where we're working on range of motion and quad activation, and then phase two where we get into more active things, poles, backing up, stuff like that, depending on what your vet has okayed at that point for them to continue doing or to progress to. We also have a return to work, um, where it has hand walking and then all the other different progressions to getting them back in shape while they go through this process. So it's really incredible. And it's all right there on our app, and I've been using it for one of mine that has had some stifle soreness and stuff. And so it's just so easy to follow, and the videos are so descriptive that man, it's been very helpful, and I'm excited to see how this horse does. Just from the standpoint of, I think some people will go get an X-ray, see the X-ray is clear while they're sore, so then we inject it, and maybe there might be another step in there where you get an ultrasound or some other type of imaging. We're like, all right, we have a clear X-ray. Let's get an ultrasound of the ligaments and cartilage, make sure that there's nothing there. And so all of them are different on what you can start out doing, of course. But yeah, I highly encourage people to investigate further on what they can do to help their horse with a stifle issue, especially to help prevent it from happening again.
Yeah, again, strengthening is a very key part of injury prevention, whether it's for us or for our horses. And so, if we can keep them strong, that's going to help protect them when they're competing. And, the other thing that I've given the Stifle program for is like a horse that does just have hind end weakness. Or an EPM horse, we could very easily say, just rebrand this Stifle program to be an EPM program. What a horse that has went through EPM and has hind end weakness because of that, because basically it is just getting your range of motion and then getting your active strength and then your powerful strength and getting them to return to work. And so it's a it is a great program. Is it easy? No. It is going to take you time to rehab your stifle horse. But if you are not in an area where you have like a great rehab facility that you can send your horse to aquatred or things like that, this is like the poor man's version of it. I'm always on a budget. We have in years past sent a horse off to be aquatredded, which was great. The gal did a wonderful job. But the work wasn't done when he came home. We still had to get him back to the arena. And so this is kind of a nice bridge, even if you do send your horse off to the rehab center, you still have to get back on them and get them ready to go back to the arena and their discipline. And so this is a nice bridge program too for that.
I agree. Even if you're just returning your horse from being off for the winter and getting ready for the year, this program is great, and it doesn't require any type of special, um, really equipment besides maybe some poles on the ground that you step over or something like that. But a lot of this you can do yourself. So I want to make a few points here, just because I love the crossover between relating the human body to the horse's body. So let's look at a few things. The quad muscle, main stabilizer of the patella in the horse and in the human, essentially. So the quad muscle is one of your main stabilizers. The rectus femoris also performs hip flexion in the horse, just like it does the human. So those are some interesting similarities there. The hamstring also helps to stabilize the joint, just like it does in the human. Another thing that we know about the hamstrings is that they're important for a horse's balance and propulsion. So as we ride, our hamstrings are very important for our balance as well. So I thought that was very interesting to see that in there, that how important the hamstrings are for balance for us and for our horse at the same time. I thought that was very interesting. And then the other point I want to make is if you do any type of overuse or really any knee rehab that I have done, the glute medius plays a huge part in stabilizing the lower body as a whole. So stabilizing your pelvis to take pressure off of the knee joint. So the glute medius also is a stabilizer for the horse's pelvis to keep it in alignment so it doesn't put abnormal pressure on the stifle or hock as well. So finding those similarities in rehabbing a horse versus rehabbing a human for these injuries, I thought was very interesting in the science behind it.
Yeah, and I'm glad you brought up the hamstrings because it's interesting, like when you are assessing like trigger points in a horse and like the now I'm learning the acupuncture of a horse and the diagnostic acupoint palpation exam. There's trigger points that are in the hamstring that will indicate stifle dysfunction. And so they get big knots back there, just right, at the very bottom of their butt, as it curves around and it ties into their leg. If they get big knots back there, you could probably guess there's dysfunction in the stifle. And so I also think about that with horses that are diagnosed with fibrotic myopathies. That's usually where they'll get those as well. And I think a person should also take a look at their stifle if your horse has been diagnosed with a fibrotic myopathy, which is a tear in their hamstring, and then they end up getting kind of a bone growth in there. But why did they tear that hamstring? Why did they strain it? And did that also then strain the stifle too? So just some food for thought, just correlating some of those things since these horses can't talk to us. We've got to be able to read the signs in their body telling us what is going on.
Yeah, and if you have tight hamstrings and it pulls on your knee, then your knee can't work like it's supposed to. And it's amazing how much relief you can get from just releasing the hamstrings and the calf in most cases to take the pressure off the knee. Same thing in the horse. Release the hamstring in those certain points and see how much more range of motion and function they have just by doing that simple thing.
Absolutely. Yeah. And, a lot of times when the horses have a stifle dysfunction, they don't really want us to stretch their legs. I know we had one that he had kind of chronic stifle stuff going on. He was a booger for the horseshoer to do his hind end. But we ended up stretching him, using a lead rope around his pastern. And, because I mean, he was dangerous about it. Sometimes he wanted to kick you or he'd just slam his foot down, and you didn't want to get caught under there. So, when horses are in a lot of pain, they sometimes don't want to be messed with. And so, actually, I had a gal here yesterday that was learning some equine therapy, and that was one of the things I taught her is how to stretch a bad one, so you don't get hurt. And it kind of an old cowboy trick that I learned from the guy that I worked for in high school, Sonny Keene. If they don't want to stand to get their feet done, you lead them by a foot, lead them by all 4 feet. And it works great for stretching them too. You just get a rope around their foot, make sure it's something that is going to rope burn them, and you don't have to get into a huge fight, but it keeps you in a safe position so that if they do want to throw a fit about it, you're not going to be caught underneath them or hurt your back and things like that. It keeps you in a much better position. And so, for those of you that are like, yeah, well, I can't stretch my horse because he's such a jerk, well, that's a way that you can do that. And like my horse Big, when he's in pain and he needs to be stretched, but he decides he doesn't want to, he just slams that foot down and, he tosses me like a little rag doll, So, you just gotta he gets stretched with a rope because he's just not, he does not like that. He's more comfortable now because we're getting a few more things figured out with him, but big thing is you got to stay safe. So, that's one way that you can stay safe on these sore horses that are big and powerful.
Yeah, so whenever you go to progress a horse, what are some things that you're looking for? I mean, obviously you're looking for symmetrical range of motion and then working towards symmetrical strength. Um, what are some of the ways that you can recognize that as you go through this process in order to progress your horse to the next phase?
Yeah, so I want to see them being able to reach up under themselves better, watching their gait. And mostly I do that at a trot on a circle, which can be difficult if you're in an acute stifle injury type of a thing. Then I would just assess it more at a walk. Circles are harder on stifle horses than just straight lines. And so you might have to have somebody lead it for you so that you can watch or set up I mean, we all have a great phone with a great camera, set it up on a tripod and try to video, from the side if you don't have anybody to help you. But really that gait assessment, gait quality, um, how long they can hold those tail poles. Uh, are they able to clear over the cavalettis without, tipping, knocking the pole? Are they getting that good range of motion? So it's just a lot about the quality of motion. Also, like if you go to lift their off leg, can they stand on that injured leg? And if they can stand on it longer, so you hold up that other leg longer, that's progression as well. And so those are all things that indicate that you're making progress. Or if you aren't, like they're worse, then you can probably guess, okay, they're getting sore from it, or maybe we're a little more inflamed. And so don't forget the use of modalities during your stifle rehab. That's a very important thing. Um, uh, Modalities that I use on stifles are microcurrent. I have these great little microcurrent units that are battery operated, and you just tape them in place. The Assisi loop, we've talked about that before. That could increase your blood flow and really helps with some of that joint discomfort. Even the rock tape, the kinesio tape, there's some stifle taping techniques that you can use for that. That'll also help improve the proprioception in the joint, the horse's awareness of that joint, and the swelling. And so there's a lot of adjunct therapies that can help with that. Your MagnaWave, your PEMF, your beamers, those kinds of things are all helpful as well. Your lasers too. I love lasers on stifles, and if they'll relax and kind of cock that stifle so you can get right around that kneecap, I really feel like they find that beneficial. They do a ton of releasing with that as well.
What are some of the things that you look for when you're trying to discern between a stifle issue and a hock issue in their gait?
That's a good question because if they're sore in either one of them, they'll get some toe drag. And so a lot of times I will watch the quality of their gait. And like yesterday, we worked on a ton of horses, and the cutting horse from this past weekend, he cut 4 different times, and he kind of had a funky move on one of his pivots to go the other way. And he was a little sore yesterday in his stifle. And the way I determined that, first, when we watched him trotting in a circle, he just had a different look on his left hind leg. And so then as we went through our palpation exam, he had some trigger points as we did the diagnostic acupoint. He triggered right back at that hamstring, at the lower end of that hamstring. And then he was a little bit tender to palpation on the inside of that stifle, kind of where the adductor muscle group comes in too. So we worked on those areas with him, and we also did some modalities on him and stretching, and he was significantly better after we got done. So, hopefully it was just like one of those things like, hey, he tweaked it and wasn't anything serious. He wasn't lame per se, but he was just a little shorter when that leg was on the outside of his circle. Um, and so, because it just didn't reach up as well. So that's kind of how we used a variety of different ways to identify that that was maybe more of an issue with him. We did joint mobilizations on him, we did body work on him, all that kind of stuff. And I just think he honestly was just kind of sore from having that many cuts on him in 2 days.
Excellent. Yeah, more of like a recovery type soft tissue session that enabled him to get some relief in those sore muscles.
Yep. Yep. And we'll keep an eye on it and see, we'll just make sure that it's progressing the right way and not regressing. So we'll keep watching his gait and just again, know your horse, watch your horse, watch how they move, and it's hard when you're the one always riding them, but you can always get them on a circle around you and just watch their quality of movement. And you get them on hard ground, and that is going to tell the tale. That will bring out lameness like no other. So, and even if you have a little bit of a slant to your wherever you're trotting them around, that'll really give you a good idea as to whether or not you have some lameness in any of the legs.
Just performance wise, how are they in the box? Do they,
Yeah.
are they more ratty in the box all of a sudden for no reason, or are they refusing the gate, or are they running by the barrel? There's all sorts of things that can mean that something isn't right, and some of us may be a little too quick to go to that deal, but really, it's if they do something that's out of character, you got to think that there's possibly something going on rather than they're just doing it to do it. And so, yeah, I know that definitely with one of my horses, she gets a little more ratty in the box and doesn't score as good when she's getting sore, and it's
Mhm.
usually an easy fix at that point to address it right there, get her worked on, and then she goes right back to being solid in the corner again. So, yeah, definitely pay attention to those performance signs as well.
Yeah, for sure. You need to always be watching, and like we have a mare that she's Gracie's pole horse, and she's a phenomenal athlete. And if it happens once, like they're a little bit uh like we're like, well, she didn't like the ground. That's why she didn't set for that first stand pole. And that's the common barrel racer, pole bender, didn't like the ground. Or a lot of times people say, oh, she just wanted to be a bitch. Well, consistently she didn't like the ground in a lot of different places. And so it's like she'd set for her turn and then she'd pop up out of it and wouldn't really use her butt. Well, we knew she was getting sore. And so, and when we took her to the vet a couple weeks ago, she had been actually, this mare had an old hock injury that we almost didn't buy her because of it. And so we've, babied her along. We've been very proactive in keeping her healthy, stretched, injections when she needs it, that kind of stuff. And we hadn't injected her for over a year. And she was pretty sore, and honestly, she did develop some compensatory strategies, which she still has now. She had injections 2 weeks ago. She still isn't quite right on that leg, and so yesterday was a great day for us to, really dive into that and work on her. She is working better on the pattern, but she's not fully back to normal movement, if you'd say, on that left hind leg. And so, as long as we can continue to progress her movement and make sure that we're still strengthening and stretching, she should get back to normal movement. And that's where I think a lot of people will, well, most people are pretty good about going and getting the injections, and then they think that should just solve everything. But if that horse did develop some habits or some different movements because of the soreness, you got to address that too. Otherwise, it ends up staying as a performance problem. And so most performance problems develop because a horse is hurting. And so they either, aren't turning as good, or they're losing their hind end or whatever. Or they run up the fence, whatever. You got to fix the problem that started it. And then you've got to fix the muscular issues that develop because of it. And you got to fix the training issue that developed because of it. And so I think a lot of people skip those other steps. They get a diagnosis, they get the injection, they think the horse should be good again. But sometimes you got to help them a little bit more with it. I mean, stifle injuries can be so frustrating, because I do think they are kind of hard to diagnose, but I do feel like you can bring them back even from a pretty significant stifle injury. There's so many great products out there, like the regenerative therapies now, and we know so much more now than we did years ago. It used to be that if they injured their stifle, it was a done, their career was done, and that's not so much the case anymore. Sometimes, like we had one years ago that he tore his collateral ligament, and we rehabbed him successfully, but he did get more anxiety in the holding pen, and he would sweat right over that stifle that was the first place he'd sweat. And so I made the decision that he didn't need to be a full-time barrel horse anymore, like, and so he was a great horse, nice horse. Sold him to a 4-H'er, full disclosure, all of his history, what had went on. That horse was amazing for her. Really helped her accomplish a lot of dreams. And so even though they're maybe not gonna get back to exactly what you intended, if it's a very serious injury, um, they can still be very useful in many aspects. And so it is worth taking them through those that rehab, because it might be something where it can still be a useful horse for somebody else.
And like she said, if you are on a budget and you have this diagnosis and you're working with your vet to get this stifle rehab, or you maybe just don't know what to do, and feel free to reach out to us. This stifle program is great. I've looked it over. I have a horse on it right now, trying to bring him back, and just good prognosis all around. And from a performance standpoint, I think he's going to come back stronger than ever, really. I mean, we have a good prognosis from his injury, and then bulletproofing it with this program. I can't wait to see what happens. I'm about to put my good horse on it, just because when you have that star number one horse and you're going, you always got to have that star number one horse, because especially if you don't have much behind it. Obviously, most people are blessed with two or three of them, and some of us aren't. Some of us, we just got that one. And again, being able to keep that horse healthy so that we can stay going. This is a very affordable, simple thing that anyone can do at their house. So.
Yeah, and we've had great feedback. I've had vets recommend it to people that want a little bit more direction, other than, okay, we're going to do stall rest, and then we'll let you start hand walking it. Like, I mean, the vets don't usually have a ton of time to hold your hand through the whole rehab process. And so if you're looking for a little more direction as to what to do, when to do it, how to do it, that's what this program is. Like Destry said, we've got videos, and we've got a sheet that you can print out, like how to, what to do when. And it really does give you a lot more direction on what to do and when to do it and how to do it. So take a look. And if yeah, it's on Teachable, and then it's also on our exercise app. And so it is one of the programs that you can purchase on the app as well. And so, yeah, give us a shout out if you can't find it. We'll give you a link to it.
Yeah, definitely. Pivotpointequine.com, and definitely check that out if you have a horse that's needing some help and you can't afford to send them to a rehab facility and you're not sure what your next step is. Man, we'd be happy to figure out how to work with your vet in order to get them the help that they need through this exercise program. So thank you all for listening today. Hopefully you got a lot of information out of this that can help you. And as always, let your health be the pivot point to your success.